but good morning, everybody. Welcome to this town hall. So glad you could join us this morning. I'm Sushila Jayapal, Multnomah County Commissioner for District 2, North and Northeast Portland. In a moment, I'm going to turn this over to our moderator, Danny Ledesma, but just wanted to say a few things before I do that. First of all, this is the first virtual town hall that I have hosted. You have heard this on repeat, but good morning, everybody. Welcome to this town hall. So glad you joined us this morning. Bear with us if we have any technological issues. I am crossing my fingers that there won't be any, but if we do, please bear with us. Second, I really want to thank my fellow panelists, Congressman Earl Blumenauer and State Representative Tana Sanchez for joining me here this morning. I also really want to thank them for the work that they are doing during this emergency. You know, there are a lot of things that have become even more clear during the course of this time. And one of them is the importance of collaboration and cooperation between your levels of government, your local government, your state government, your federal government. And I just think we are so lucky in Portland and in Multnomah County to have a state delegation and a federal delegation that is so responsive to the needs that we are seeing on the ground. So thank you again to Congressman Blumenauer, Representative Sanchez, for everything that you're doing. And then the third thing I want to do before we dive into the nuts and bolts of our response and your questions and comments, I really want to take a moment to acknowledge how strange and how difficult this time is that we are living in. It is strange to be wearing masks. It is strange to be standing in lines at the grocery store spaced 6 feet apart. It is strange not to be able to hug our kids and our parents and our friends. It is so difficult for people who do have to leave their homes and go out to work, for our healthcare workers, for our first responders, for the folks in our fields, for the folks who stock our grocery store shelves, our TriMet workers, for all of the people who have to go out and take risk for themselves and for their family in order to keep the rest of the economy and the world running for the rest of us. So thank you, we appreciate you. And then I also want to recognize how difficult it is for the people who are at home. They're home working and managing kids who are out of school. They're home because they've lost their jobs and they are struggling to put food on the table and pay their rent. They are home because they have had to close their small businesses and lay off employees. This is a really difficult time. And I want to acknowledge that. And I want to say that none of us can fix it. But what we are all committed to do is to walk alongside you, to support you, and to do everything that we can to make sure that we all come out of this as whole as possible. So with that, I want to turn this over to Danny Ledesma, who is going to start us off with a land acknowledgement. Over to you, Danny.
Thank you, Commissioner Jayapal, and thank you to everyone who's attending, and thank you to our very esteemed guests, folks who are going to be here today. My name is Danny Ledesma. I'm Apache and Latina, and Multnomah County and Portland have been my home for over 18 years. I'm really proud that our community strives to strengthen our relationships with the Native community and Native nations. A symbol of this commitment is a land acknowledgement. These statements bring visibility to the First Peoples of our collective home. And this statement is meant to provide information and context, while also encouraging all of us to reflect on our current day relationship with Native people and Native experiences. We acknowledge that we live, work, and play on the traditional land of the Chinook, Clackamas, Kalapuya, Multnomah, Wasco, Cathlamet, Tualatin, and Molalla. We also know that many other tribes made their homes along the Columbia and Willamette rivers. We honor their history and acknowledge the sacrifices they made. Let us also acknowledge the robust present-day federally recognized tribes of this area, the Grand Ronde, Siletz, and Cowlitz. In addition, I'd like to acknowledge the Chinook Nation, who has been seeking federal recognition for many years. The urban Indian community is made up of tribal diversity that originates from around the country, representing 400 tribes. The urban Indian community has a vivid history made up of people whose journeys have brought them to Portland by ways of forced displacement or by seeking more opportunity. Today, these tribes and communities celebrate their heritage, showing resilience and tenacity that would be greatly admired by their ancestors. We encourage every person to reflect on their own history, understand the history of colonization and genocide, and support Indigenous sovereignty, priorities, and actions. This acknowledgement is one step that we can take to improve our support of Indigenous communities in Portland. Thank you for that. I would now like to, before we begin, just review a few housekeeping items, since this town hall is in a new and unique format. So the way that we're going to engage with folks who are watching and participating will be a little bit different. Our first 30 minutes of the town hall will allow each elected official to share information about the work that they're doing at all levels of government that they represent. After that, we'll take questions from the audience, and we'll do this in a couple of ways. When many of the audience members or the viewers RSVP to this town hall, you also provided questions, and we'll go through those questions. You're also welcome to submit any questions you may have via the comments section on YouTube, and different staff will track and make sure that I get those questions and try to get those answered. We also want folks to know that we have staff on hand who can provide resources to needs that you may have identified. So please feel free to include these comments or these questions in the comment section, and we'll make sure that we try to get to respond. Finally, we want to let folks know that today's town hall is really focused on COVID and the coronavirus, and we ask that that you focus your questions about that. So if you have questions that aren't related to COVID, please feel free to put those in the comments, and we'll try to follow up later to answer those questions or any other questions that we were unable to. So with that being said, I'm going to start, and I'm so honored to be able to introduce Congressman Blumenauer. We're really grateful to have Congressman Blumenauer represent us today. He's been a progressive champion in this community at the state, county, and federal levels. And he has been leading the fight in Congress to get frontline healthcare workers the resources they need and assistance into the hands of struggling Oregonians. I want to thank Congressman Blumenauer for his service and ask him to start us off today.
Thank you, Danny. And I was thinking, as you were dealing with the land acknowledgement, how poignant that is. The people whose presence you acknowledged, who are part of our history, were themselves ravaged by pandemics like measles. The tribes that you referenced, like Grand Ronde, there were hundreds of thousands of them in this area. And in a few short years, they were decimated, including pandemic, down to where the Grand Ronde was looking like 1,000 people. And I think it underscores the timeless nature of these challenges, how difficult they're going to be, and recognize that this is a shared experience that we are having now. And I hope from this, we can draw some strength. I appreciated what Sushila said. None of us have ever encountered anything like this, but in a sense, we've been training with our public service, our work in this community, to be able to be a resource at this moment. We are all in it together. We've not seen anything like this for a century. I mean, the Great Depression had the economic upheaval, but we didn't have a pandemic at that point. There was the flu during and immediately after World War I. But try and imagine what those two would have been like together. And that's kind of what we're approaching now. We have some advantages today that we didn't have then. We have a little better sense of what we can do to try and correct problems with the economy. Back with the Great Depression, the federal government held back. They were still trying to balance the budget. They weren't dealing meaningfully with the needs of the unemployed. I think we've learned some of those lessons. We've even learned lessons from what happened with the last Great Recession, where it's clear that despite the controversy, and I remember this very clearly because I was in Congress then, there were some people who were feeling that we were doing too much. Well, the experts in reviewing that have concluded that no, we didn't do too much, we didn't do enough, and we didn't stick with it. And I am hopeful that we don't make that mistake this time. I make no secret of the fact that I am frustrated with the reticence of my Republican colleagues in the Senate to be able to embrace the package that we put forward in the House, including with Susheila's sister, Pramila, who's one of the leaders of the progressives in Congress. We had a pretty robust initial series of things that would have made more of a difference. Unfortunately, the Republicans in the Senate and the Trump administration wouldn't go along with them. So we're fighting some of those battles now to try and strengthen that effort. I am pleased that you've seen a variety of things that took place. I mean, we were able, despite all of this, to put almost $2 trillion out into the economy, expand unemployment in ways that it had never happened before, having a payment, a universal payment to try and help people in need. We have the Paycheck Protection Program that lots of glitches, lots of questions, but it is putting billions of dollars. They've distributed already almost $350 billion. Oregon, I think, is being a little shortchanged, but it's making a difference here now, even as we try and fight through the difference. We've also been able to put more money on the front lines. We're pushing for testing. We're pushing for assistance for our hospitals and state government. The unemployment expansion, $600 a month, $600, excuse me, a week, is a very important development, and it expands to more people. But as anybody who has been struggling with that system knows, it's not been, shall we say, a smooth transition. And in fairness to the Employment Division, in one day last week, they took more applications than they did in the entire year before. We've been working with the delegation to try and have the state expand the program so that extra week of benefit would not be lost. And I'm pleased that the governor announced recently that the state would go back and get that extra week that will make a difference for so many of our families. But we're not done. We have a real challenge to be able to get these programs out, up, and running. The state, as I mentioned with the Employment Division, is fighting, but they are hiring more people. We gave them some money to help improve the administration, and we're all trying to help people who are confused and in need. I mean, I start several days a week just listening to people who've contacted my office complaining about the state unemployment division. Not that I have any control over it, but we can help sometimes with giving people information. It's important to hear so that we can all do a better job working together. Susheila said something that I think is really important, because in this unprecedented time of stress, we're literally navigating uncharted waters here. We're working hard trying to make things happen, but we're all stressed and strained, most importantly, our families at home. And I can't say enough about how much I appreciate what's happening with the other areas who are our partners in government. We had a great session with Tanya's colleagues in the legislature earlier this week. We had a great interaction with each of her colleagues. The work that's being done with local government. We're in contact literally every day with things at the state level. And I think people are coming together in a way that is remarkable. We've got a lot of problems ahead of us, and we're going to have a lot of work to get out the other side, hopefully better than when we went in. That's going to be a long time coming. But I would just conclude on one note. We can go back and deal with some details later. But I think it's really important that attitudes are shifting even in Washington, D.C. 4 months ago, we were fighting for paid family sick leave. That was controversial 4 months ago in Congress. You know, I think if we were going back on those debates now, it wouldn't be so controversial. People understand that paid sick leave is critical. What we're seeing now in terms of the appropriation of the appreciation of childcare. We've been fighting for more support for childcare program, and my two co-panelists have been in the thick of that fight at the state and local level. All of a sudden, in the middle of this pandemic, people understand that childcare is an essential service. We can't have education, we can't have healthcare, we can't have public safety if those frontline workers cannot have quality, affordable childcare for their families. And so I think there are things here that we are going to make some progress. We're having some realization. We're getting more money out the door. It's not as much as we need, but it happened more smoothly than it's happened in the past. And so I'm optimistic working together, we'll be able to fashion things that are long overdue. I'm convinced that we'll be in the middle of this struggle for the next several years, but I welcome it because these are things that we haven't addressed. These are problems that have been festering under the surface. These are inequities and challenges that need to be acknowledged, and we need to work together on them. And I think in the midst of this crisis, we're finding people understanding some of the things that my colleagues and I have been working on for years. The final thing I would say is we're not going to be able to get to everything, I know, but Danny said that we all have staff members who are monitoring this, and there are opportunities for people to send their own text messages. If there are questions and concerns, even some that are off topic, feel free to submit them. And we'll attempt to sort through them and get back to as many people as we can over the course of the next week. But thank you for the opportunity to join my colleagues. Thank you all for taking time out this morning to be a part of this important conversation. I'm looking forward to learning as we go along. Thank you very much.
Thank you, Congressman Blumenauer. I know that we have many of our folks here in Portland and Multnomah County who'll be really excited to be able to ask you some more questions. I now get to introduce our state representative for House District 43, Tana Sanchez, Representative Sanchez. I'd like to tell folks a little bit about Representative Sanchez. She grew up in Oregon and has lived in North and Northeast Portland, the district that she serves, for the past 23 years. And during that time, she helped co-found the Native American Youth and Family Center. She received a master's in social work at Portland State University and was elected to the Oregon State Legislature. A major focus of Representative Sanchez's work has been in the area of domestic violence, child welfare, and foster care at both the state and local levels. As chair of the House Judiciary Committee, Representative Sanchez continues to work for reforms in the Department of Human Services while also trying to make our criminal justice system more humane. In her personal life, Representative Sanchez has helped raise more than 18 foster kids. So please welcome and thank you so much. Well, let's give Representative Sanchez an opportunity.
Thank you, Danny. Let me just say, I'm so excited to actually listen to some of the things that the congressman is talking about and thinking, yes, that's the one we really need to talk about right now. But I first want to start out with just that whole recognition that the congressman said about tribal populations having experienced something like this in the past over and over again in different areas. As a matter of fact, smallpox, measles, those types of things. And unfortunately, a lot of folks have a lot of underlying health conditions, given the change in diet and the things that happen to them during those times of transition onto reservations and things of that nature. So it's becoming clearer and clearer every day that a lot of people of color have a lot of underlying health conditions, have a lot of issues that are causing them to be, unfortunately, more susceptible to the virus in terms of having much more significant conditions that are, in fact, killing them. So, I just wanted to say that and acknowledge that, and also recognize that, in particular for Native populations, we survived it, right? Our ancestors survived that, and we will survive this, right? I just want to say that out loud because I think where we are at this moment in time is making people very, very nervous. It's very frightening for a lot of people. Some people are very nonchalant about it. We could go either way, but it's something we have to pay attention to and think about and figure out how do we do this best for everyone. That message of stay home and save lives is so very, very important going forward, because you don't want to be the one who's asymptomatic and spreads that virus to someone else. So those things up front. I also want to acknowledge that we were talking about this earlier, and I've talked about it with many people recently on these different types of forums, and or just to just to people I'm meeting with on a regular basis via Zoom and Google Hangouts and all of that stuff. We're in a time of shift and change, right? Our societies shift and change all of the time, but when we have these big major pieces, these economic downturns, or the pandemic of 1918 shifted everything, and we will shift again. But one thing that's coming out of this that's amazing is that people are recognizing that you can communicate a different way, that you can maintain some level of closeness on a different level, and that things that we didn't think were possible before are in fact possible. So it's just important for me, and to recognize that, acknowledge that, and to also recognize that when we talked, I mentioned earlier about the issues with people of color, but also recognizing that a lot of those folks that we are now referring to as the heroes out there in the world, the people who are doing the hard jobs, the farm workers who are actually out there still, bringing in crops, those people cleaning the hospitals, those people driving delivery, to folks who are staying home and staying safe. How at one point we may have undervalued those folks. And now we're shifting that dynamic and that conversation to say those folks are really, really important to not just our health and welfare at this point in time, but to our economy. And I just wanted us to really think about that, because in the state legislature, we've been working for a really long time to try to help people get to a place where we see that childcare piece is so important, that that minimum wage is so important to get to a place where people can survive and have what might be a living wage. It's also so very, very important that we recognize that we're not just one job or the other. Like, we shouldn't value these higher paying jobs over these other jobs that shouldn't be low paid, but we should value everyone's job, and we should value them as human beings and recognize that everyone deserves that same type of help and support in childcare, in paid sick leave, in all of in healthcare. And access to that healthcare is so very, very important. And where we sit right now, as the congressman mentioned, this shouldn't be a problem. It was, and it shouldn't be going forward. We've been fortunate in Oregon to be able to bring some of that to the right place at this point in time. We're not all there, but getting there is going to be very, very important. And it's also very, very important that we don't go backwards and forget all of that, forget what struggle we're in right in this very moment in time, and don't try to shift some of that for ourselves, because it again, it's not going away right away. Epidemiologists are expecting this to ebb and flow, to change and shift a little bit in terms of how we do our business, our daily lives. We have to be prepared to try to, again, think outside the box about how we communicate, how we do the work, how we move forward in the world. And it's not going to be easy. But as I said, Indigenous people survived pandemics before. And so we can do this again. We can move forward and do this again. We have to recognize that everybody's a part of the system. It's not just urban areas. It's not just the rural areas. But what happened in the last recession is that communities of color, small businesses, and rural areas did not come back as well. as we had hoped and anticipated they would. And I think that that's going to be the important thing to put an emphasis on, that smaller businesses, communities of color, in particular rural areas, will need the support that we can give them to come back and to make a robust return to life as normal will be in the future, because it's never going to go back to the way it was. That has to be a conversation that we have and are able to articulate to ourselves. We're not the same way we were 10 years ago. We're not ever going to be the same as we were 2 months ago. And I know that's hard, but I'm a social worker. I think like that. I want to think through telling people it's going to be okay. It really is. And I also want to mention that one of the things that I've been fighting for in the state legislature is that we put more investment in our alcohol and drug treatment programs, into mental health services, into overall our system of health as it relates to the area that people struggle in. And I'm hoping that we can move resources in that direction as well, because I know that, as people are stuck in their homes, they're struggling with those things. They're having a hard time. We know that purchases of alcohol has gone up. Purchase of marijuana has gone up. Those things can happen. We're not sitting in restaurants drinking alcohol or anything anymore, but the purchases have gone up because people are struggling, and they're going to struggle. We're going to struggle with mental health, and we don't have the mental health system that we need at this point in time, and never did. We need to move that forward and try to shift and change that. So those are some of the things that I'm thinking about as we're having these conversations about what are we going to do in the future? How are we going to bring this forward? So yeah, thanks.
Thank you, Representative Sanchez. I know that we're starting to get a lot of questions about the state's response, so we'll look forward to hearing from you more. I now get to introduce our host, Commissioner Jayapal. Sushila Jayapal has served as Multnomah County Commissioner for District 2 since January of 2019. She ran for this seat because she wanted to continue to make a meaningful impact on the daily lives of our most vulnerable residents. The commissioner was born in India and came to the United States when she was 16 to go to college. She has lived in Portland and District 2 for over 25 years. As an attorney, she was a litigator at law firms in San Francisco and Portland, and then became general counsel at Adidas America, responsible for legal affairs and human resources. Prior to her current role, she was a community advocate and volunteer, serving in board leadership positions with a number of nonprofit organizations. As Multnomah County Commissioner, her priorities include ensuring that everyone has a safe and affordable place to call home, reforming our justice system, enhancing the lives of our most vulnerable residents, including immigrants, refugees, and people of color, and working to ensure that clean air and water for everyone that there is clean air and water for everyone who lives here. She chairs a number of community collaboratives, including the Gateway Council on Domestic Violence, the Multnomah County Sex Trafficking Collaborative, the Multnomah County Domestic Violence Family Review Team, and the Metro Policy Advisory Council. Commissioner Jayapal.
Thank you, Danny. And I just want to reflect on a couple of things that I heard Earl and Tana talk about. The idea of resilience, which I think is so important. Tana, thank you for bringing us back to that. And the notion that we are going to be doing some things during this period of time that we will find that we want to hold on to. Things that Earl talked about around sick pay and cash payments to people and childcare and all of these systemic problems that we have all been wanting to work on and have been working on for a long time and have been told that it will take a long time to do, and we're seeing them happen very quickly. So I think those are things to really hold on to as we continue to work through this period of time. So I'm going to pivot a little bit, and I'm going to talk in a more sort of nuts and bolts way about the work of the county, because we got a lot of questions about that up front. And so I want to talk a little bit about some of the major areas of work that we're focusing on during this period. We are the local public health authority. And so a couple of buckets of work that we do in that capacity that are really important at this time. One is communication and education. So we have from February, actually from late January on, been starting to work on communication and education around what it's going to take to slow and prevent the spread of infection. And that takes a whole bunch of different forms. I'll just touch on a few. Issuing guidances for different kinds of businesses, for restaurants, for food service, for healthcare settings, and putting those guidances on our website. If anyone still has questions about those, you can reach them on our website. And then getting out in the community and making sure that folks understand the direction and guidance that we get from the Centers for Disease and Control and for the Oregon Health Authority, and continuing to broadcast that out. So that's the first bucket, communication and education. The second bucket is coordination. We, as we've all talked about, have been working very closely with our neighboring counties, with the cities within Multnomah County, with our state delegation and our federal delegation, to make sure that we are coordinating the response on the ground. And just a couple of examples of what that coordination is about. It is, for example, about coordinating the distribution of personal protective equipment, PPE. So the county gets its allocation from the state, and in turn, we distribute it out based on a prioritization that our healthcare systems have agreed on, first to healthcare workers, then to first responders, and then on down the list. So that's a really critical coordination function that we've been performing. Similarly, we've been working closely with our healthcare systems to plan for capacity. I don't have access to this, but there's a real-time tool that our public health department has access to that tells them where the bed capacity is, so that they can work with the hospital systems, work with folks who need those beds to make sure that people have access to what they need. So coordination, communication, policy. The most significant policy action that the Board of County Commissioners has taken has been around our residential eviction moratorium. We enacted that moratorium, I think it was back in early March, and we enacted a residential moratorium that applied to protect any tenant who was unable to pay their rent because of losing their income due to COVID. In the time since, the state has enacted its own moratorium, and that is both a commercial eviction moratorium and a residential eviction moratorium. We've adjusted ours to align with the states, and so now the state and Multnomah County moratoriums apply to any loss of income for any kind. So any tenant who can't pay their rent can give their landlord notice as soon as reasonably possible that they can't pay their rent. In Multnomah County, we have an additional layer of protection, which is that you will have a 6-month grace period after the emergency ends, and it's currently slated to end in July for Multnomah County. You'll have another 6 months to pay that rent back. So that was something that we viewed as an immediate priority, recognizing that as a public health matter, we can't have people losing their housing at a time when, from a public health perspective, we know they need to stay home. There are so many other reasons why we can't have people losing their housing, but from a public health perspective, which is what we had to focus on right off the bat, we knew that we had to get that done. So that has been the most significant policy piece that we have. And as I said, on the state level, there's also a commercial eviction moratorium in place. So communication, coordination, policy, and then really the bulk of our work has been to adjust the services that we provide so that we are protecting both our public, our clients, and our staff. The largest bucket of work there has been addressing the needs of our people who experience homelessness. So we have moved very rapidly on 3 different fronts. First of all, we have stood up in the space of 2 weeks, 2 to 3 weeks, we have stood up 4 new homelessness shelters. These shelters don't create new beds, but what they do is allow us to move the people in our existing shelters into the new ones so that we can create adequate space between beds to prevent and slow infection in our shelter population. We have 4 of those, as I said. We've used the convention center. Thank you to our partnership with Metro for that. We've used the Charles Jordan Community Center in North Portland, the Mount Scott Community Center, and the East Portland Community Center to create these distancing shelters. And at the shelters, we're providing meals, we're providing laundry facilities, we're providing showers. The meals in and of themselves have been a huge undertaking, and we are really proud of the partnership that we've created to provide those meals. We're partnering with Stone Soup, which is a nonprofit organization, and Stone Soup in turn is partnering with local restaurants that have had to shut down their businesses to contract to provide those meals. So it's really been beneficial for everybody involved in the partnership, and we're so grateful to Stone Soup and to those restaurants for helping us provide the meals. In addition to standing up those 4 new shelters in order to get distancing, we have also stood up 2 new medical motel shelters, and those are to house folks experiencing homelessness who've been showing symptoms. And so they are in medical motel shelters that allow them to have their own rooms, and that allows us to isolate them from the rest of the population, again, to slow the spread. And then the third thing we've done in partnership with all our nonprofit providers is to conduct extensive outreach to the folks that are still out on our streets and in vans who are unsheltered. We've reached over 2,000 people with information on laminated cards about what they need to do if they can to, and we know how hard it is for folks who are on the street to do these things, but information about what they can do to slow the spread. We've provided supplies, hygiene supplies, tents, blankets, bottled water, all of the things that we hope will help to slow the spread in our unsheltered population as well. A fourth effort, and this isn't something that the county is working on directly, but we're partnering, it's really being spearheaded by the city, and I want to mention it because I know people are concerned about it, and that is that the city, in coordination with Join, will be setting up 3 temporary outdoor shelter sites. These will provide wooden platforms that are appropriately spaced so that people can put sleeping bags and blankets on those platforms. There will be hygiene facilities, hand washing facilities, shower facilities, all the things that we can do to allow people to have a space that allows us, again, to slow and prevent the spread of infection in our houseless population. Each of those sites has 45 tents, but 2 people could live in a tent, so each one could house more than 45 people. So that's some of the work that we've been doing around our population of people experiencing homelessness. Our health clinics, this is something else that I know people are really concerned about. We've consolidated our health clinics. We haven't kept all of them open, but we have 4 health clinic sites open. The clinics are still seeing walk-in patients, and they're also still providing telemedicine. We still have a student health center that's open at Park Rose High School. We're still providing dental services, although those are limited to urgent dental care services only. And all of our pharmacy services sites are still open. So that's health clinics. I want to talk about public safety. Our community of population in our public safety system, like our homeless population, is one that we know from what's happening around the country is particularly at risk. And they're at risk because the physical constraints of being in a jail don't allow social distancing, and because many of the folks in our jails and prisons have other conditions that put them additionally at risk, underlying health care conditions, or are at ages that render them at risk. So a few things that we've been doing around our prison and jail population. We've been working closely with all of our public safety agencies, and that is the Multnomah County Sheriff's Office, the County Department of Community Justice, the District Attorney's Office, the Portland Police Bureau, and the court system, to do what we can, first of all, to reduce the population in our jails. And we're doing that primarily by slowing the intake. Officers now have the ability to, for certain low-level misdemeanor offenses, instead of issuing an arrest and citing somebody and booking them in the jail, they have the ability to issue a citation and set a court date for farther out in the future, for when we are past and through this pandemic and we can have courts reopen again. That has really brought down our jail population, and we're currently at about 60% of normal capacity in our 2 detention facilities. We've also been working in those detention facilities, again, to create the appropriate distancing. We've opened up new housing units so that the beds can be separated appropriately. We are cleaning and sanitizing more deeply and more frequently. We are screening all new entrants into our jail facilities and isolating them in single cells for 14 days and monitoring them every day to make sure that they don't have symptoms before we put them in the regular population. And for those who are at risk, either because of age or underlying medical conditions, we're actually screening those folks for 30 days before we put them back into the general population. So those are some of the things that we're doing in our public safety system. To date, we have only had to test 3 people, and none of those people have tested positive, but we are really mindful and vigilant of the risk that's faced by our population in detention, and we'll continue to do everything we can to prevent the spread there. The last sort of substantive bucket I want to talk about is food access. And this is something that I think all of our partners are seeing at all levels as a rapidly growing need. Multnomah County has always and continues to provide food access for our schools. We are working at 20 school sites to help provide food access for our students. We are also working with our senior population to provide food to homebound seniors. But what we're seeing, and we're providing meals, as I said earlier, to our people experiencing homelessness. But what we're seeing is that the need for food is spreading rapidly beyond those groups. It's spreading to people who are still housed, but are struggling to pay for their rent and pay for food. And so we are really pivoting to working closely with our partners to seeing what we can do to address food access. So those are some of the big buckets that Multnomah County has been working on. I want to mention a couple of things that I and my office have been particularly focused on. One is domestic violence. We are seeing, I want to back up for a second and say across most crime areas, we're actually seeing a downtick in crime. In the area of domestic violence, we are seeing a significant increase. We've seen about a 10% increase in bookings for domestic violence into the jails. We're seeing significant increases in the calls for service, and particularly for shelter. As just one example, one of our crisis lines spent in 1 week for housing vouchers what it would normally spend in a month. So that's a 4-fold increase. And I think we've all who work in this field have expected this. It isn't so much that there are new cases of domestic violence happening. Rather, it's that where you have existing abusive relationships, the stressors that the COVID emergency has created have heightened the risk of that turning into physical violence. And as that happens, we are seeing the increase in need for shelter, in need for restraining orders, and all of the other services that survivors need. I want to make clear that the services still exist. We are still running our crisis call lines. The Gateway Center is open via phone for people who want to reach out and reach a caseworker. The courts are still providing restraining orders. I think we got a lot of questions about this, so I want to be clear. Courts are still providing restraining orders. They're doing them telephonically. And our crisis call lines, as well as the Gateway Clinic and our other domestic violence service providers, can walk you through the process on the phone, help you file it on the phone, and get a restraining order that way. I've been focused on this because of some of the collaboratives I chair, and because this is a real area of interest for me, also advocating for increased funding for resources for our survivors. Multnomah County has put in $100,000 just in the last weeks to create more housing vouchers. Thank you to the state legislature. I know that it's on the top of their list of priorities, and we're advocating with our federal delegation as well to create additional resources. So domestic violence has been an area that I've been working on. And then the other thing that I and my team have been working on is just to make sure that we are reaching our immigrant and refugee communities and our communities of color with the information that they need in the way that they need it, in the way that makes sense, is culturally appropriate, that allows them to ask questions. I think this has always been an issue. And as we've talked about, there are many things that get heightened during this period. And we're really seeing that we have to work even harder to make sure that our particularly vulnerable communities are getting the information that they need. So I'm going to stop there and turn it back to you, Danny, for questions and comments.
Okay, thank you, Commissioner Jayapal, and thank you to all of our electeds for those remarks and information. We're now going to move to questions for our elected. So to viewers, if you haven't already, please go ahead and provide any questions or comments that you may have for one or all of our elected officials to answer. So far, we've been getting quite a few questions about testing and the reality of testing. And so I have a question for all three of you. If you could, for Commissioner Jayapal and Representative Sanchez, if you could describe to us the type of testing that is currently available, and sort of also if there's anything at the state level that we're doing to expand the availability of testing. And for our congressman, we had a very specific question, wondering if there's been any movement to think about how a test would be available for all U.S. Residents. So why don't we start with Commissioner Jayapal, if you wouldn't mind just giving us a little bit more detail about how many tests are available, what type of tests are available, and then we'll go to Representative Sanchez and then the congressman.
Great, thank you, Danny. That's such a great question, and I know it's top of mind for so many people. I'll answer from the county perspective and give you what numbers I have from the county perspective. I do have some numbers at the state level, but Representative Sanchez may have more up-to-date numbers on that. So from the county perspective, we are running tests only for patients who come into our healthcare clinics. And we have a capacity in our clinics of about 160 tests per day. We are prioritizing people who show symptoms and are in some of the at-risk categories, either by reason of age or underlying health conditions that put them at risk. We are prioritizing anybody who's a frontline worker and is going to be coming into contact with other people, and that's so as to slow the spread. So that's what we're doing around testing, and really keeping an eye on, as we develop more capacity, what will be the next groups of people that we want to test. So, remembering again that there are a number of different purposes for testing. One is to let people know if they're at risk that they really need to go home. Anyone with symptoms should be going home to begin with, but to be providing them the care that they need. But then also epidemiologically to be able to understand what's happening with the spread of the disease. So that's what we're doing at the county level. And I toss it over to Representative Sanchez for the state perspective.
So as I'm sure everyone's aware, there are not enough tests. We are trying to get testing out to different areas that may not have necessarily had them initially because there wasn't necessarily, that type of spread out in maybe some rural areas. However, test kits are actually getting out to more rural areas, different hospitals around there. But again, they're small, like they're in smaller batches because that's just the way they came. There's not enough out there. There's not enough of the elements out there to make sure that testing happens. That, however, yes, it's been a problem. It has increased significantly, obviously, since all of this started. In the very first, weeks in end of February, first part of March, you saw those really small numbers of like 100 and however many people being tested. We're up to 36,321 tests as of, I believe, a couple of days ago. Yes, the 17th. Though that's happened. That's not enough. Clearly, we actually need to look at increasing that over and over and over again to make sure that we can get a better idea of how many folks may actually be infected. Now, let me just also say, I want to be real clear about this. While there are not enough tests, there is also not the surge that other areas and have experienced. We have nowhere near something like what New York has. Obviously, we don't have that many people who have either shown up at hospitals. We have a particular graph that we're receiving on the state level that shows us, how that's looking in the hospitals themselves. We have enough ICU beds. We have enough ventilators. We're not seeing the surge because we did a really great job starting early. That doesn't negate the fact that people want to have a test to be able to know for sure if they have the virus. So the tests are going out there. We're actually getting, I wish I had that number off the top of my head. We are getting to the capacity of having a much larger number of tests being able to be done in a day. I think when we originally started, it was like 40 to 80 tests in a day. That's gone up to, I'm sure it's over 1,000. It's well over 1,000. I just don't have the number in my head right this very second. I apologize for that. But I do want to reassure people that tests are going out to rural areas. Tests are being done, not just in state labs, but in other labs that have been able to help us out with those things. It's happening much faster than it was before. There are tests that are being done that can get results in 45 minutes. Other ones are taking a whole lot longer. I realize those are not the answers that everyone wants to hear, but they are happening. We are increasing that volume day by day. And as I think maybe you even saw on the news this morning, is that OSU is trying to do larger tests around Corvallis simply to see where we are in terms of the ability to trace where the virus is going and how it's expanding. Again, just wanting to remind people that despite the fact that we may not have the number of tests that we want out there and that people feel like they need to be tested, and you're supposed to be able to get tested if you have those symptoms that say you might have the virus, it may not always happen. But what we know is that we do not have the volume of people who are entering our hospital systems and or who are dying from this virus. So again, harsh words, I get it, but let me just say, if you are really interested and really need to know those numbers, I can have my staff pull them up for you and get them out. If people want to email in and ask for those, we'll get them out to you.
Thank you, Tanya. And you're right. We're nowhere near where we want to be, but there is progress that is being made. What is maddening, I know, for the state and the county is that the testing that the president grandly promised almost 2 months ago has yet to materialize. And some of the supplies we get, there aren't the swabs, there aren't, some of the kits aren't complete. And the workers that are administering the tests need the protective equipment. The gowns, the masks. So it's so difficult for the local providers to be able to navigate this. But I am pleased that at least the tests are getting out. I think there is some progress. There is progress at the federal level, and the availability of these tests are going to tell us when we can appropriately start scaling back the restrictions that we have in place. But before we can do that, we're going to have to be administering over 15,000 tests a week. And that isn't itself the complete picture. And that we have to be able to follow up on the positive tests. So I really appreciate what is being achieved at the state level, at the county level, with our providers who are doing the best they can. And what Representative Sanchez said, we are seeing some bright spots in terms of how Oregonians have responded. The states have moved, the local governments have provided the leadership and the efforts, and Oregon is not anywhere near what some of these other states and particularly some of the metropolitan areas have had just disastrous impacts. What we're attempting to do on the federal level is to hold the administration accountable. We are providing more resources. It's not a problem of money. It's incompetent management, an inability to prioritize appropriately. And that's an ongoing battle that we have literally every week. The congressional delegation is working together to try and make sure that we are treated fairly. And there are some of the parts of the system that actually disadvantage us. The way that we provide our Medicare coverage in Oregon, particularly in the metropolitan area, because we have a lot of Medicare Advantage programs that can give people better coverage more cost effectively. Well, the formula that they used to allocate resources was based on people who had traditional Medicare. So it underfunds our community, it underfunds Oregon. And so we're on an ongoing basis, just trying to fight this through to make sure we get our fair share. The president has the capacity to compel more production. There is an act that was enacted during the Korean War by President Truman that the president claimed that he was going to invoke, but he hasn't used it to deal with the companies that produce the test and to be able to ramp it up. And that's part of an ongoing tension to try and get the performance. Testing is going to be key for our coming out of it. I am pleased that so far we've been able to meet the emergency needs for tests in medical facilities. As Representative Sanchez mentioned, there's been a dramatic increase, but it's not near where we want, and we're going to have to continue both the fight for testing, and then we all have to keep the social distancing in place for at least the next month or two, because that's the only way that we can effectively stop the spread, and that's going to help us come out the other end faster. The last thing we want to have happen is to do this inappropriately and quickly, too quickly, so that we come back with another surge in late summer or fall, and we're back in the middle of it, and the pain continues and more people are at risk. But so far, Oregonians have been rising to the challenge, and I commend my colleagues on the panel for the work they've done to make the best of a difficult situation.
Thank you, Congressman Blumenauer. I have just a quick follow-up question about testing with regards to the data that we're getting about who is testing positive. Do you know at the federal level, are there any efforts to look at how different communities might be impacted more heavily, such as communities of color, and if the federal government plans to respond to that disproportionality? Do you know if that's part of the planning?
The CDC is gathering data on the healthcare disparities. And one of the things we know, and my colleagues on the panel have made clear in the work they've done, is that when we get hit with this healthcare crisis, it magnifies existing disparities. We have in Oregon, the Latino community is wildly disproportionately impacted, and the Black community, and not quite as much, but still much higher. We have people of color who have disproportionately occupied employment positions that come in contact with people. These are folks that are involved with food production, healthcare, nursing homes, a variety of employment positions that make social distancing more difficult, that put people at risk. And we know that communities of color already have disproportionate impacts in terms of pre-existing health conditions. Tanya mentioned the problem with Native Americans. We've had long-standing challenges, in part because the Native health services from the federal government have been underfunded. There's greater incidence, for example, of diabetes. These underlying health conditions make them more vulnerable now. And the combination of these items really is troubling, to say the very least. Now, the federal government is monitoring this through the CDC, but so far we haven't seen appropriate investments to be able to remedy it. And I hope that that's part of what we can do together to be able to focus on these challenges, focus on the health challenges for people who are farm workers, who are essential to provide the food, being able to deal with healthcare workers, childcare workers. I am hopeful that we'll be able to do a better job. And I appreciate Commissioner Jayapal talking about the special challenges for the prison population in our prisons and jails. Those are ticking time bombs. We can't have social distancing. We put extra money in the federal prisons, and gave authority for early release. The administration isn't doing much of that. I actually have an essay that's coming out in the Politico magazine on Capitol Hill on Monday that talks. The title is "We're Not Singapore." People who are sentenced for non-violent drug offenses shouldn't be given a death sentence. What you've done at the county level to be able to strategically reduce the population in a way that doesn't jeopardize public safety is so important. We can't afford to have our jails and our prisons be incubators for COVID-19, because it's not just confined behind bars, because there are people coming in and out of our jails and prisons every day, returning to the community in the short term and the long term. And it illustrates.
Oops, sorry. Oh no, I was going to say, Congressman, thank you so much for bringing up the prison population, because we've had quite a few questions about the federal response. And before we have you answer a little bit more about the federal response specific to prison populations, I'm wondering if you can provide just a little bit of an overview. We had one question about the federal stimulus package. One person who wanted to know, could you tell us a little bit more about where the funding for that came from? And we've had several questions where people wanted to know, what are we doing to ensure, can you tell us a little bit more about the intent of the legislation and the intent of where we wanted that stimulus to go? Because we have quite a few questions about what are we doing to ensure that the people who really need this, that small businesses, people working in the gig economy, folks who are going to be disproportionately impacted by the economic fallout of this epidemic are really getting that, are getting access to that federal stimulus. So if you wouldn't mind just giving us a brief technical primer, and let us know a little bit about the intent.
And I heard you say brief. I'm sorry. I just
That's okay.
I'm a little bit carried away. And Danny, you're doing a great job to try and keep us under control. Particularly, some of us politicians talk for a living, and feel free to bring me back. But I did feel strongly about that item, and I've been hearing some. Well, let's talk for a moment about where the money came from and what we're trying to do to make sure that it is targeted where it needs to be. We were able to put together almost $2 trillion in less than 2 weeks, and start getting that money out. And it was actually extraordinary. Those of you who follow what happens in the federal government, we seldom move at lightning speed, at least on things that are very, very important. So this is remarkable. There are people around the country who are getting the benefits of these, even on systems that are over strained, and have been actually neglected for years in terms of this basic infrastructure. And the Internal Revenue Service is one of the probably Exhibit A, where my Republican colleagues have been cutting the personnel at the Internal Revenue Service and its equipment. And now all of a sudden we're trying to use the IRS to be able to crank out huge number of checks. I don't know exactly why Donald Trump's name is on. Well, I know why it's on. It's maddening. We have higher priorities than helping him stroke his ego. But that is, there's been some very serious underinvestment in something that we rely on. The money is basically going to be borrowed. We're having the Fed basically printing more money. We're going into debt. But I think it's reasonable that we do that at this time. There was almost $350 billion for the Paycheck Protection Program that was designed to help smaller enterprises be able to keep people on the payroll and pay the rent and the utilities. That rollout has been slow. One of the things we're deeply concerned about with the House Democratic Caucus and why we have not embraced the next round of Republican proposals just to throw money at that system, which underserves some critical areas. In Oregon, we got far less than our proportionate share for that program, for instance. And there's too much that goes to some of the larger organizations and not so much going to smaller community banks and to smaller enterprises. So we're fighting to try and make sure that the next round of funding, and there will be another round of funding, does a better job of meeting the people who need it most. Part of what is maddening is that we could only get that going with unanimous consent. It was very hard to be able to put all the ducks in place, get the agreement, get it through the Senate, and be able to get it enacted. Part of the price that was paid, and it just makes my blood boil, is that there was a change in the tax treatment for some of the wealthiest of Americans. We don't have enough money for the needed services, the tests, the equipment. We've got hospitals that are in some parts of the country on the verge of collapse. We're going to have a serious problem with state and local government. And there was $100 billion giveaway to some of the wealthiest of Americans to make a tax benefit that they had even more generous. These are things that it's impossible to explain to a normal person. But that was the price we had to pay to be able to get $2 trillion out the door and in the economy. It was essentially a bribe that I just find unconscionable. And I'm hopeful that we'll be able to go back in the next round. Our Democratic leadership is holding firm to be able to make sure the next rounds are focused more on people who need it and to avoid making our deficits worse and shortchanging our ability to get help to those who need it the most.
Thank you. So thank you so much for that. I'm wondering if we can maybe shift to our state's response, because you had mentioned that we were through the stimulus funding, that we were able to provide some added relief for folks who became unemployed as a result of this. We've gotten several questions about our state's unemployment system and some frustration about being able to apply for benefits. And so I guess, Representative Sanchez, if you wouldn't mind telling us, there is a general sense that our state system, our state unemployment system, isn't working. Can you share for us, briefly, what are some things that we can do? Do you have any ideas about what we can do to make it easier for folks who are unemployed to be able to access that resource and find some relief quickly?
Forgot about the mute again. So I know people are frustrated. What we do know is that originally our employment department, of course, as the congressman mentioned earlier, has been obviously just putting through as much as they possibly can. We started out with just over 100 people actually processing these things in the very beginning. We've hired many people and are in process of getting them moved forward to make sure that can happen. There are over 400 people now working on that. The continuing to hire people to make sure that we get to all of that is actually in process right now. We know people are frustrated. We know that people think they're afraid, because they don't know if they're going to get that response. They don't know if they're going to get that benefit that's necessary to be able to pay the rent, to be able to buy food, all of those things. Just know that the state is in process. We are actually doing really just an immense amount of work to get people through that, through the system as much as possible. It is best to send that email, to do the process online and go through that email process of getting that taken care of and asking those questions via email. The same people who are answering the emails are answering the phone. So if they're spending time on the phone and doing the email at the same time, they're like doing double work. The phone is not the best way to do it. Don't frustrate yourself by being on the phone. You may feel frustrated by having to wait for that email response, but it's better than being frustrated for however long it takes to get through on the phone.
Representative Sanchez, the congressman mentioned that you had a great meeting with the delegation. And one of the questions that has come in has been about some of the choices that the Oregon Department of Unemployment has made concerning the CARES Act. And so if you could, did anyone talk about that? There's been a lot of questions around because of the Oregon system not fully coordinating with the CARES Act. There are quite a few folks that are either not eligible for unemployment. And so I'm wondering if that was part of the conversation, and feel free, Congressman Blumenauer, to talk about that as well.
I don't think that that was not necessarily part of the conversation, but let me tell you, there have been situations that were a little bit of a sort of a glitch situation that happened within the employment department that caused a sort of a kickback of applications where people were thinking that, well, I am one of those gig people, I am one of those self-employed people, and they submitted that application online thinking that they would be able to get that benefit, but that was kicked back because the system wasn't ready for it. They can resubmit, and we're fine at this point, as far as I know and understand it. That I think may have been the problem, or the question that came up around it, is people thinking that we weren't necessarily cooperating. I think that's not necessarily true. The systems just weren't ready to handle it, was my understanding.
Yeah, may I just, the state needed time to be able to make the transition to, like the people in the gig economy had never been eligible before, and it took time to make that transition. I want to emphasize two things. One, Tanya said, apply online. This is critical. Don't spend, I mean, I started the week with somebody who'd spent 2.5 hours on hold. Don't do that. Make sure that you apply online. That holds your place in line. There's a record of that, and it protects you. And it actually helps free up the system so that they can deal with applications online faster, and you are protected. The other thing is file every week. Keep filing. Don't give up. And that is also very important. One of the challenges that drove us crazy is initially the employment department was not going to give the extra week of eligibility to Oregonians. And we went kind of back and forth on that. And the governor has directed the Department of Employment to deal with the system so that people will be eligible for that extra week of $600. That's going to be 150, $200 million that will ultimately get to Oregonians. There was concern that if they tried to do the reprogramming right away, it would delay getting far more checks out the door. But I think what the governor has directed the department to do is to stick with it, and ultimately people will be paid that retroactively. And I am pleased with her order to the employment division, because that's going to make a huge difference to people in our community.
Thank you. Commissioner Jayapal, we have been talking about several vulnerable communities, and we've had a couple of questions about seniors. And I was wondering, when you talked about the communication function of Multnomah County at this point, I'm wondering if you could maybe tell us a little bit more information about how the county is coordinating with coordinating information to get it out to seniors. So there's the question about seniors who who may be facing food insecurity. So you let us know about that. But then there was a question about misinformation and how seniors who are isolated in their homes alone are getting misinformation, and if there's been any efforts on the part of Multnomah County to try to specifically reach out to seniors.
Thank you, Danny. Another great question. You know, I think all of our hearts go out when we think about seniors being home and being isolated, not being able to get out, and really becoming vulnerable in even more significant ways to misinformation and even fraud and abuse. The county has we have a Department of Aging and Disability Services, and that department works year round with our senior population in terms of arranging transportation, getting access to food, helping them get out to medical appointments. And so we've really continued to provide those services. We're not able to do it unless it's an emergency situation in a face-to-face way anymore. But we continue to serve our senior population telephonically. We work with nonprofit partners that serve our seniors. And so the Urban League Metropolitan Family Service, these are organizations that have well-established networks to continue and try to get information out to our seniors. And then of course, we've got our website with a lot of information, including on how you can help if you've got a senior neighbor who's in isolation, and our social media that we push out to try to reach folks. But it is a significant issue. And again, I come back to, it's also a particular issue for our seniors of color and for our immigrant and refugee seniors who have language access issues on top of that. So we continue to work really hard to get all of that information out as best we can. Danny, I wanted, if I could, to just jump back to a couple of points that Congressman Blumenauer made a while back. I want to talk, just say a couple things about testing and the question around testing and data around race and ethnicity, and say that I think that's something that we continue to have to push on. Our data in the state of Oregon and in Multnomah County tells us what percentage of positive cases have tested by race and ethnicity. What we're not collecting, or that I've not seen so far, is percentages of people who are being tested, because I think that tells us a lot about access to testing, and that's the gateway to the rest of the process in this emergency. So I think there continue to be some of it is a data lag. But I think we all, to whoever asked that question, thank you for asking it. I think we all need to keep pushing to make sure that we're getting the data that we need. And then wanted to just agree with Congressman Blumenauer on the question about jail populations and how important it is to bring those jail populations down, and what we've been able to do in the county, both in terms of slowing the intake and also starting to very carefully release people from jail so that we can bring the capacity down. I think this is another area where we have all been recognizing that we have an over-incarceration problem in this country and trying to figure out ways to address that problem. And we're doing it in a very careful, thoughtful way, and we've done it very quickly. And so I think that brings us back to some hope that some of the changes that we're making right now will be things that we want to hold on to and that we want to continue to push forward when we come through with this.
Thank you. Well, so Representative Sanchez, I'm wondering, I've got a two-parter for you. We had someone who was wanting a little bit more information about why would we close parks, the state parks? Because when you're out hiking, you can be, pretty, social distance could potentially be achieved. But then I'd like you to kind of start taking us to when you think when the state might reopen. To your knowledge, will Governor Brown provide another update around the state reopening? And do you know anything about potential legislative session, a special legislative session?
Oh my God, thanks so much for all of that. Well, let's start with parks. My understanding, and it seems very logical to me at this point, because in the very beginning, what was happening is that people, of course, you get very afraid. People think, oh, well, I'll just go camp way far away from the city into a campground and somewhere off, and I'll be safe. Well, a lot of people thought that way, and they started inundating campgrounds early on, right? And then we also knew, of course, that people would be, had reservations for campgrounds. And what our big concern was is that essentially you would create another situation where you could have a spread of virus based on a lot of people congregating in one area. So that's part of the reason. What I personally know is that I didn't want people in particular going way out into some of the camp areas and possibly getting sick and not having the resource or the availability to take care of themselves or to come back in and be treated for the virus if in fact they may have had it. The sorry, you mentioned something else. That one rolled in my brain. When are we coming back? It's very clear that the governor would like to know, kind of get everything really solid and figure out where we are going in terms of federal resource before we determine what we're spending from a state level. But we're also really trying to determine that ourselves. As you know, our session ended rather abruptly. And the budget that we had in place at that point in time simply didn't go forward. What we know is we have a certain amount of money in our e-board, our emergency board, to be able to do some pieces that we need to have happen, but not enough. So we will need to get back in at some point to really start moving more resource into that fund, and or moving more resource in different directions. I suppose in a way we may be fortunate that we didn't put money in all of those different places, because now we have a greater reserve to be able to do some of the things that we need to do. We're simply holding maybe a little steady to make sure that we're looking at what our projections are for the future. We're wanting to make sure that the May forecast comes in with, we want to know what we're working with, right, in the May forecast. And knowing that right now we're able to hold somewhat steady with what we have and what the federal government has contributed. The governor will obviously come back on board and tell us like the process. I think people are a little maybe nervous or confused about her last press conference that was basically saying it's going to be a rolled out process. It kind of has to be. I think the priority is making sure that we don't do this so fast that we end up with the surge that some other areas have had. This is not going to, it's not going to just go down really easily. We know the folks who are asymptomatic could be a very large issue. And we just want to make sure that as many Oregonians are safe as possible. That really is, I think, the most important thing. As I mentioned earlier, we're not seeing the surge of other areas. We shut this down fairly soon and pretty hard. And I know that was difficult for folks, but Oregonians' lives are being saved now because we don't have that happening. We've had, I think the numbers, I don't remember where we are, is around 70 plus folks had passed away because of this virus. That is, a horrible thing to have happen, in any state or any community. We know that a lot of vulnerable people have died because of this virus. We simply can't take that chance, I think, on other people dying in order to just, work our economy. I just don't think, you have to work that balance, right? What's worth it, what's not. I did want to jump in. I know we thought originally an hour and a half. It's too long. No, it's not. It's not long enough to talk about all of these things and really get deep into some of the issues. I do want to say our state prison system is a larger issue. The governor did say that she was not going to do early release for some folks. I think there's overall a concern about that on both levels, that the overcrowding does exist. I have to say that the DOC is doing some pretty significant work to make sure that it doesn't spread. Clearly, what's happening is that it is the people working in the prisons that are part of the problem bringing the virus in. But the DOC has shut down people coming into the prison to try to make sure that we didn't bring the virus in as much as we probably could have had we allowed visitation to continue and to allow contractors to come in and volunteers to come in. It is not easy. It is frightening for people who are incarcerated. We do want to have larger conversations about making sure that those people who are eligible for early release, in terms of those people who participated in alcohol and drug programs and all of that type of thing, are being able to move forward. We want to make sure that system gets back into place so that folks can get that early release and we can move as much people as possible into the exterior of the prisons. However, that also means that they have to have a place to go. That system has to be in place well.
Any thoughts about a legislative session,
Um,
special legislative session?
I would imagine sometime in May.
Thank you. Well, as the representative reminded us, time has flown by. So we're going to move to our last question. Before I ask the last question, I do want to let our viewers know that staff are on standby. And so folks who are reaching out with questions about specific places where they may need to be pointed to resources, questions that didn't get answered, we'll continue to take those questions and provide answers. We tried to get a broad range of topics. So speaking about the legislative session, and since we have our 3 elected officials, I do want to kind of close out with a final question about our democratic system of elections. We had a couple of questions wondering about not only the impact of the pandemic on our everyday lives, but about our voting system. And there were some concerns about how this may impact or how the administration's response to the coronavirus may impact elections. And so I wanted to ask Commissioner Jayapal, we have an upcoming local election in May, and I just wanted to, as the body that oversees our county election and our election system, if you had any concerns about that. As you all know, in the state of Oregon, we are very fortunate to have vote by mail. And so being able to vote by mail in a pandemic is one way to ensure that democracy keeps going. And so I'd like to ask Commissioner Jayapal first about our local election, and then turn it over to the congressman to ask a little bit about, if you wouldn't mind, sharing just brief thoughts about the upcoming fall election and how you think that this could be impact the fall election, and share if there's any promising movement that you've heard around federal vote by mail. So, Commissioner Jayapal.
Thank you, Danny. Thank you for the question. You know, I think this is a place where Oregon can pat itself on its back. We are a vote by mail system. The county elections office is underway and staffing up to manage our May election. Our voters' pamphlets are already online in multiple languages, as we always do it here in Multnomah County. So we are feeling very comfortable and confident that we'll have our election as we always had. We have worked with our federal delegation around security issues. We're all very mindful of those, and we feel that we're in a good place on that as well. We'll have some logistics to manage in terms of the staffing, because it really takes a significant number of temporary staffing to manage those ballots as they come in. And so we'll need to be taking precautions around physical distancing as we run the sort of that manual back end of the process. But we have been working on it for the last 4 weeks during this emergency and even before that. And I'm feeling very comfortable that we can do this and we can show the country how we do it.
Yeah, I am proud of our county election system and the state vote by mail. We were the first state to have entire vote by mail elections. That was how Senator Wyden won his first election, was the first national all mail ballot. And ever since then, Oregon has led the way in terms of people being able to vote at home on their own time. We have no problems with hanging Chad. We have no problems with people. I mean, I'm tempted to try and deal with some of the hypocrisy. Donald Trump is against our vote by mail legislation. This is part of what we pushed for in the original emergency legislation, and it is part of where we are now to be able to expand vote by mail to those parts of the country that do not have it. Part of it is a public health issue. You saw people in Wisconsin risking their lives to stand in line, and nationally, the people who work at the polls average over 60 years of age. they are a population that are vulnerable. And the Republicans are against vote by mail, but they are willing to vote absentee. Donald Trump voted absentee in Florida, but he's against these protections in other parts of the country. We're working very hard to extend it. The former Secretary of State here, Phil Kiesling, is part of a national coalition that we're working on. I think we're going to have a good dry run with the primary election here to be able to stress test the system. I appreciate what the county has done, but we think that this is the time to be able to have a national vote at home opportunity. There ought to be universal access to an absentee ballot so anyone who wants to vote at home can do so without excuse. Now, the number of states that require this are declining, the states that require an excuse, and the Republicans are fighting it because they think more people voting hurts them. Well, I don't know about that. I suspect they may be true, and they're working hard to discourage young people, people of color. They reduce the number of polling places in the entire city of Milwaukee from 150 down to 5. But the voters there turned out in significant numbers, and they're going to turn out every place where there's an opportunity to vote by mail. This is part of what we are fighting for this year, and I think we're going to make more progress.
Well, thank you so much to all of our elected officials. I have to say, I'm so proud to be a Portlander, a Multnomah County resident, and an Oregonian. I feel so fortunate to have such esteemed elected officials and public servants that are fighting for all of our issues and all of our concerns. And so I want to thank you for the time that you took today. Thank you so much for bearing with us in this new format. And also thanks so much for I know you're also passionate about all of these issues and passionate about the folks that you serve. And so I know we didn't have enough time, but here's to hopefully many more opportunities for you to be able to connect with your constituents. Thank you so much. I'm going to turn it over to our host, Commissioner Jayapal.
Thank you, Danny. I just want to close out by again thanking Danny for her awesome facilitation skills. Thanking my fellow panelists, Representative Sanchez and Congressman Blumenauer, for joining us this morning. I want to thank all of you in the audience for being here and for your great questions. And I want to thank you for everything that you are doing to bring us through this crisis. You know, when we think about how much our lives have changed and look outside and see that the majority of people are staying at home and that they're doing it in order to save the lives of their neighbors, I think that's an incredible testament to the spirit that we have here in Multnomah County in the state of Oregon. And I thank you for that. I thank you for your volunteering, for the donations of PPE. We got a couple of questions towards the end about what more you can do. Thank you for asking that question as well. And I'll say that Multnomah County has a site where you can go online and learn how to donate PPE. You can learn how to volunteer. On my webpage, we have some links where you can donate funds to nonprofit organizations that are providing critical services. So there's lots more you can do, but the most important thing of all, stay home, save lives. Thank you so much.
Sushila?
Yes, sir.
I would refer people to my Facebook page and my web page. We have compiled lots of resources, and I think people might find it useful to refer to that as well.
Thank you for that. And I did get a note that we've gotten a lot of questions about small businesses and the impact of the CARES Act. And I'm sure that your website will have resources for folks who had specific questions about that as well.
Thank you, Sushila. Thank you, Tanya. It's an honor to be with you. Danny, thanks for keeping us on track.
Yeah.
Thanks, everybody.